Welcome to our Sunday specials. Medical doctors are essential workers in the day-to-day affairs of the health sector across the world. But in recent years, there has been a mass exodus of Nigerian doctors to Western countries. But this special report by TVC News senior reporter Godwin Agwam highlights major reasons for the brain drain, including advocacy for increased remuneration.
Provision of adequate manpower is essential to operating a functional health facility across the globe. This entails the availability of medical doctors, nurses, lab scientists, and other health workers. But in recent years, Nigeria has been experiencing an increase in the number of its indigenous medical doctors leaving the country for other Western countries in droves. Data from the Nigerian Medical Association reveals that between 2016 and 2018, over 9,000 doctors and 500 medical consultants were reported to have left Nigeria in search of greener pastures in the United Kingdom, USA, and Canada. This is as a result of poor remuneration, poor welfare packages, and unregulated working hours of medical doctors. One aspect that has completely been neglected, which is taking a toll on the mental health of practitioners, is the unregulated working hours, and this is greatly influencing the brain drain syndrome in the country. Research conducted by the Nigeria Journal of Clinical Practice reveals that in Nigeria, there is a doctor ratio of 1 to 9,000 patients, as against the 1 to 600 patients recommended by the World Health Organization. This has forced many medical doctors to work for 72 hours unregulated shifts, making them burn out and also increasing medical errors. Dr. Micah Otu is a physician with one of the tertiary health facilities in Nasarawa State. He arrives at his office to meet patients waiting for consultation. This forms part of his daily routine, aside other clinical services that require him to work for a 72-hour non-stop shift.
Very strenuous. The work schedule is tight. So as a doctor, I come to work usually, and the clinic is usually very heavy. Usually it's once a week, and then the next days are ward rounds, and then our unit take calls. Because usually in some centers there are no house officers, so the doctor on call will work from the morning of that day till the end of work the following day, because there is nobody to take over from him.
Just a stone throw within the same facility is Dr. Noah Victor, who is a pediatrician. His story is not different from the former.
We still have doctors working for 36 hours straight. That's because they do 24 hours call, and then the next day they continue the duty as if nothing happened the next day. And you will not expect a tired doctor to give all the best at a particular time because of this increasing time for that doctor spent within the hospital environment.
Dr. Bello Yakubu is a physician with the Federal Medical Center Kefi and the spokesperson of the Nigeria Medical Association in Nasarawa State. He tells us how the unregulated working hours of doctors affects their mental health and is taking a toll on the doctor-to-patient care relationship.
Hospital must run 24 hours. But that 24 hours must not be run by one person. You can get the best. If I stay awake to run emergencies all through the night and continue during the day, I'm not only putting myself at risk of collapse, I'm also putting my patient at risk of what? Poor services.
The doctors believe that the unregulated working hours of doctors is one of the factors influencing the brain drain syndrome in the country's healthcare system.
It is a major push factor. It is a major push factor. Remember, doctors are human beings. They are not machines. Even machines wear out with time. These are human beings. They have families. They are not operating different from any other human being.
Every doctor you know has a friend who has moved for greener pastures, or who is currently planning to move, or who is going to move for greener pastures. So this is contributing to the brain drain we are currently experiencing.
Dr. Al-Amin Usman is a Nigerian medical doctor in the United Kingdom who I met via LinkedIn. In this interview with TVC News, he tells us about the working hour model of the United Kingdom and why it is attractive to Nigerian doctors.
Here in the United Kingdom, they have adopted, the General Medical Council, which regulates the working hours and every affair of every doctor here in the United Kingdom, has adopted, the European Working Time Directive for all workers, and it stated that every worker works just 40 hours a week.
Dr. Al-Amin and other Nigerian physicians agreed that the ball rests in the court of the Medical and Dental Council of Nigeria to design a policy for regulation of working hours of doctors.
To provide solutions to that, I would say we need to know where we're starting from, and then we need to look at other systems, compare other systems. This is where the studies, the research comes in, which is very important.
Doctors are also human beings. That must be seen. And once that is recognized, then there must be a policy that will insist that you work between so hour and end by so hour.
We also have people who are already trained and who are waiting for jobs. Many institutions are not taking as it should be, and then even the ones that are taking, for example, the state settings, the remuneration is not the same as for other settings. These things drive the movement of doctors around.
The demand of the doctors is loud and clear. It is expected that the Medical and Dental Council of Nigeria will come up with a document that will improve the working hours of doctors in order to have an effective and sustainable healthcare system. Godwin Agua, TVC News, Lafia.
Well, that's TVC News this hour. For more updates on the stories we're monitoring, you can visit our website. It's www.tvcnews.tv. You can also follow us on our social media handles on Facebook, Instagram, and on X at TVC News NG. On YouTube, we're live at TVC News Nigeria. Thanks for watching. Bye for now.